My name is Dr. Schurhamer, and this short video will go over focal therapy to see if you're a candidate for it. We'll also go over some of the side effects and the treatment profile if you choose it. Focal therapy for prostate cancer is part of the library of options to include watchful waiting, active surveillance, surgical resection, and radiation. And focal therapy relies on the fact that some types of prostate cancer do not actually need the entire gland treated, but what we found through years and years of studies that you can actually treat a single part of the prostate as depicted in this picture here. And so this patient here had a lesion on the prostate as visualized in the MRI, indicated by that yellow arrow there, and underwent focal high-frequency ultrasound therapy via the transrectal approach. This zone was ablated and the prostate was left intact. The important things that are denoted in this picture here are the yellow spot in the middle, which is your urethra. So this patient was left fully continent after this procedure because the urethra was uninvolved. And then these green boxes here, green triangles here on the outside, are the neurovascular bundle, which carry a large amount of the neurovascular tissue to your penis to allow for erections. So both of those structures were uninvolved, and this patient had a successful treatment. So focal therapy has been around for quite a few years, however, has increased in utilization, specifically in the United States, in the past few years. Why is that? Part of the reason why is because good studies have now come out of Europe, specifically the UK, with 15-year data that demonstrate the 15-year follow-up for patients undergoing either focal high-frequency ultrasound, cryoablation of the prostate, do have a similar failure-free survival probability to those patients undergoing surgical resection. Now, there's a lot of patients that fall into different categories here, and so this isn't a widespread to say that everyone should get focal therapy because it's the exact same, but patients that fit the specific criteria for this treatment approach appear to have equivalent results from a cancer perspective. And so anytime we can treat your cancer or your family member's cancer with a more minimally invasive approach than while providing the same oncologic outcomes, that's something that we're always going to be in favor of. So this chart here, so it's a radical prostatectomy is the blue, HIFU in cryo is the red, and what we basically kind of find here is that out of a period of 125 months or 10 years, the two curves that show failure-free survival are, we would say statistically they're pretty much the same, or they have overlap, and so there's not a whole lot of difference between the two. The important thing is that the HIFU stayed right there with the surgical resection. And so, so if this is something that you're interested in, you may be wondering if you're a candidate for it. The candidate, it is a somewhat small inclusion pool. And so, at this point, we are performing this on patients that have low and intermediate risk cancer. And so what that means is that if you look at your biopsy report, you will see that it'll be Gleason 3+3 and Gleason 3+4. And then we'll look at a few other specific criteria. So we prefer if it's only on one side of the prostate. We prefer if it actually lines up with an MRI image that was biopsied, so we can know exactly what to treat and where to treat. And then we also prefer that the disease is actually away from important structures. So that's kind of the apex of the prostate. So we don't affect your continence, away from the bladder neck and capsule of the prostate and whatnot. So there's quite a few different inclusion criteria that go into it, but that's and we can discuss that when you come to clinic. How does it work? So focal therapy is administered via a transrectal approach, via a transrectal ultrasound. The ultrasound works in a little bit of the way that a magnifying glass would work, with sun. And so basically, we know that the sunbeams are powerful, but if we can kind of aim them into one spot with a magnifying glass, we can really heat up and ablate a specific area. High frequency ultrasound works in a pretty similar way, meaning we can take the ultrasound waves that are dispersed, throughout the prostate, and focus them into very specific little areas, and would treat the prostate in a kind of spot by spot approach. And so you are asleep for this procedure. The procedure takes about 1 to 1.5 hours. No cuts on the outside of the body. We insert the transrectal ultrasound, perform the procedure, and then you would go home the same day. And so you may be wondering, so what are the side effects if I were to go undergo this procedure? So immediately, some people have pain afterwards that lasts 2, 3, maybe 4 days. That pain would be some pain with burning with urination, burning with having bowel movement, and then there's a risk of infection as well. So urinary tract infection as well as epididymitis. And then outside of that, so outside of the initial kind of post-operative period, what are the long-term side effects? So those long-term side effects, when we think about prostate cancer treatment, typically, circle around erectile dysfunction and incontinence. And so will I have erectile dysfunction after this procedure? It really kind of depends on how you come in, but we do not think, as long as your lesion is away from those important structures that I pointed out at the beginning of the video, that we can spare those critical areas. And the ED, the new erectile dysfunction rate after this, tends to be around 10 to 15%. And then and that really kind of depends on your overall erectile function coming into the procedure. Will I become incontinent afterwards? We don't think so. Some people have a little bit of urinary leakage afterwards, just kind of associated with recovery from the procedure. But typically, as long as we're, again, able to stay away from those key structures, then incontinence is not a common side effect to experience. Other than that, this video is just meant to be a primer for further discussion in clinic or on the telephone, and we appreciate you considering us for your prostate cancer treatment, and just want to be available for any other questions you may have. I appreciate you watching this, and I look forward to future conversations. Thanks.